Shaken adult syndrome, or SAS, is a newly recognized and deeply concerning form of traumatic brain injury in adults. Unlike accidental injuries, SAS results from violent shaking, often in the context of domestic violence or assault. The syndrome is characterized by a triad of injuries: subdural hemorrhages, retinal hemorrhages, and diffuse axonal injury. These injuries can occur even without any obvious external trauma to the head, making diagnosis particularly challenging. Adults, much like infants, are vulnerable to rapid deceleration forces that cause significant internal damage. The consequences can be severe, ranging from confusion and neurological deficits to rapid death. Unfortunately, SAS is often underdiagnosed, partly due to its subtle presentation and the social stigma surrounding interpersonal violence. Raising awareness among clinicians and the public is critical to improving recognition and prevention. Diagnosing shaken adult syndrome requires a careful and multidisciplinary approach. Patients may present with symptoms such as confusion, vision problems, or even coma, but these can easily be misattributed to other causes like falls or substance use. Emergency physicians must be vigilant, especially when there are unexplained neurological symptoms or a history of interpersonal violence. Imaging, particularly cranial CT scans, often reveals subdural or subarachnoid hemorrhages, sometimes with midline shifts due to increased intracranial pressure. However, the absence of external injuries can complicate the clinical picture. Microscopic examination of the brain and eyes is essential for confirmation, revealing diffuse axonal injury and characteristic retinal hemorrhages. These findings, especially when bilateral and symmetrical, are highly suggestive of SAS. Differentiating SAS from other conditions, such as Terson syndrome, relies on recognizing the unique pattern of injuries associated with violent shaking. Recognition of shaken adult syndrome carries significant forensic and social implications. In many cases, SAS is linked to domestic violence or abuse, making it not only a medical issue but also a legal and ethical one. Physicians are often required to report suspected cases of assault, even when patients are reluctant to disclose the true cause of their injuries. This creates a delicate balance between patient confidentiality and the need to protect vulnerable individuals. Autopsy findings in SAS cases consistently show the same triad of injuries, reinforcing the importance of thorough forensic investigation. Beyond the immediate medical consequences, survivors may face long-term cognitive and psychological challenges. Preventing SAS requires a societal commitment to education, early intervention, and support for victims of violence. By improving diagnostic protocols and fostering interdisciplinary collaboration, we can better safeguard at-risk populations and ensure justice for those affected. Moving forward, the medical and forensic communities must work together to refine the diagnostic criteria for shaken adult syndrome. Proposed diagnostic flowchart emphasizes the need for comprehensive history taking, careful physical examination, and targeted imaging. In living patients, cranial CT scans and ophthalmological assessments are vital, while in postmortem cases, detailed autopsy and histological analysis are necessary. Ultimate goal is to identify SAS early, provide appropriate care, and prevent further harm. Interdisciplinary collaboration among clinicians, neurologists, ophthalmologists, radiologists, and forensic experts is essential. Additionally, public education campaigns can help raise awareness about the dangers of violent shaking and the importance of nonviolent conflict resolution. By consolidating SAS within the broader framework of traumatic brain injuries, we can enhance both diagnostic accuracy and legal protection for victims, paving the way for a safer and more informed society.